I know we rushed through the end of the lecture where there were calculations, and a lot of you seem like maybe you needed a little more practice with this, so I've put together several examples that we'll go through together. These were the two examples that we worked through in class. So let's go through those again, and you can see my process of calculating out each step. In this example, we have a patient that weighs 10 kilograms, and we want to give a dose of amoxicillin. In the original slide, there was a typo. The dose I chose for amoxicillin for otitis media I got from my drug database, and we'll go with 27 milligrams per kilogram per day divided by 8 hours. So that's 3 doses per day. We're going to treat the kid for 7 days, and the strengths that we have are 125 milligrams per 5 ml and a 200 milligram per 5 ml bottle as well. The first step is to determine the milligrams per dose and milligrams per day. So we'll take 27 milligrams per kilogram per day, and we'll multiply that by our 10 kilogram weight. The kilogram units cross out or cancel each other, and we're left with 270 milligrams per day. To determine the per dose amount, we take 270 milligrams, divide that by 3 doses, and we're left with 90 milligrams per dose. In order to determine how much to instruct the pharmacy to dispense, we next have to determine the total amount of drug that will be needed for the entire course of therapy. This is simply dividing 270 milligrams per day times the 7 days duration of therapy. And that gives us 1,890 milligrams for the total dose that the child will receive. The third step is to select the strength and the package size. Oftentimes there are multiple strengths of liquid medications available, and we want to make sure we select a strength that is convenient for dosing the dose that's required, and we want to select a package size that gives the caregiver then enough volume to complete the entire course of therapy. Let's look at the 125 milligrams per 5 ml strength first. We know we need a total of 1,890 milligrams for the full course. Multiplying that by our 125 per 5 strength, our units cancel, and we're left with 75.6 milliliters needed to complete the full course of therapy. In this strength, there is an 80 milliliter package size available, and 80 milliliters would allow for the entire course of therapy to be administered without much leftover. So that would be an appropriate package size and strength to select for this prescription. If you were to select the 250 milligram per 5 ml strength, let's work that out. A total of 1,890 milligrams multiplied out with the 200 per 5 strength, our units cancel and we get 47.375 mLs. The pharmacy does stock a 50 milliliter package, and we could also select this strength and package size for an appropriate course of therapy. It would just cover the amount needed without much leftover. The final step is to determine how much volume of the strength that we selected is needed for each dose and write the prescription. So we know we need 90 milligrams per dose. If we select the 125 per 5 strength, we'll multiply that out, 125 milligrams per 5 mLs. We'll multiply 90 times 5 and divide by 125. Units cancel, leaving us with 3.6 milliliters per dose of the 125 per 5 strength. Most oral syringes come with graduations on them that will allow measurement of tenths of a milliliter. So yes, a caregiver could measure out 3.6 milliliters of the medication to get the full dose. For completeness, let's also calculate that out for the higher strength product. 90 milligrams per dose multiplied by 200 milligrams per 5 mLs. Our units cancel, giving us a dose of 2.25 mLs of the 200 per 5 strength. Now 2.25 mLs is a very small amount, and most oral syringes are not going to allow us to accurately measure out to the hundredths of milliliters. So in this case, the 125 per 5 strength is more appropriate because it's going to give us a measurable dose. It's just not, the other one is just too concentrated to get a measurable dose. So now the time has come to write the prescription. We've done all the calculations. We know the volume, we know the per dose milligrams, and now we can write it. So we write the name of the drug, the strength, 125 per 5 milligrams of amoxicillin. The directions will be give 3.6 milliliters by mouth every 8 hours for 7 days. And you notice I put in the milligram per dose as well as the volume. It's always a good idea in pediatric patients to include your dose basis, your milligrams per kilogram per dose or per day on the prescription for the pharmacist to double check. We'll dispense 80 milliliter package of that strength, and it's always also a good idea just to put the current weight of the patient on the prescription for double check as well. Let's go through the second example we covered in class. In this case, we have a 2-year-old patient who weighs 7 kilograms. We are to give diphenhydramine. Dose basis is 5 milligrams per kilogram per day, divided in 3 to 4 doses per day. That's from our drug reference. We want to treat for 10 days, and that we know that the drug strength, the only package available, is 12.5 milligrams per 5 ml. That usually comes from a stock bottle that is poured into the exact amount into a smaller bottle to dispense to the patient. So to calculate the dose for this patient's weight, we'll take the dose recommendation from our drug database, 5 milligrams per kilogram per day, multiply that by 7 kilograms of the patient's weight. Our kilogram units cancel out, and we are left with 35 milligrams per day, total dose per day. And then to determine a per dose amount, we take 35 and simply divide it by how many doses per day we will give. Let's say we'll give 3 doses per day. Our day units cancel out, and we are left with 11.67 milligrams per dose. Now, in the real world, it might be very difficult to measure out 11.67 milligrams per dose, but we don't want to round just yet. Let's get to the next step. This is an easy step. We'll take the total amount of milligrams we're going to dose per day, multiply it by our course of therapy, which is 10 days, and of course we get 350 milligrams needed for the total dose. Now we need to know how much total drug to dispense. We're going to have 350 milligrams per day, multiply that out by the units of our strength. The milligrams cancel out, and we are left with 140 milliliters will give us the total course of therapy. Our third step is to calculate how many milligrams per dose to write on the prescription. We calculated our dose to be 11.7 milligrams. In the 12.5 per 5 ml strength of the drug that we have, that calculates out to be 4.68 milliliters per dose. Now we probably should round this because we can't measure out to the hundredths of milliliters. We can round it to 4.5 milliliters. That could be measurable, or probably more simply for the parent, 5 milliliters. Now the final step is to write the prescription. It's a good idea to put the weight on the prescription, write out diphenhydramine, strength, 12.5 milligrams per 5 mLs. The directions will be give 5 mLs by mouth every 8 hours for 10 days. Remember to put your dose basis from your drug database or reference on the prescription to communicate that to the pharmacist. And finally, we'll dispense 140 milliliters. Let's do another example for each of these two drugs with different weights and doses. All right, let's do this example with a different weight. In this example, the patient weighs 15 kilograms. To work out 50 milligrams per kilogram per day, we multiply those, and over a 14-day period, each day the patient will get 750 milligrams per day. Over the total course, the patient will receive 10,500 milligrams of the drug. Now we need to divide 750 milligrams per day by the 3 doses per day. We get 250 milligrams per dose. Now we take the total number of milligrams the patient will receive during the entire course of therapy, multiply it by the strength of the product, that's 250 milligrams per mil. Our units cancel and we're left with our total volume, 210 milliliters. That means the volumes that are available in those packages, none of them are appropriate except for the 240, which will give us a little bit over the total volume that we need. All right, let's write the prescription. Amoxicillin 250 per 5. We're going to give 5 milliliters, which is the equivalent of 250 milligrams, of course. PO, Q8 hours for 14 days. Remember to put your dosing basis on the prescription as well. We used 50 milligrams per kilogram per day per our reference. And the total volume we'll dispense is 240 mLs. The patient will only use 210, but we have to dispense the full bottle of 240. Let's do the diphenhydramine example with a different patient. This one is a 23-pound patient. That's the equivalent of 10.45 kilograms. So we take that weight, multiply it by the daily dose recommended by our resource, which is 5 milligrams per kilogram per day. We multiply that out by 7 days of therapy, and we're left with 365.7 milligrams total over the course of that 7 days. If we take that total dose and multiply it by the strength we have available of that product, 12.5 milligrams per 5 mLs, that leaves us with 146.28 mils in the total volume. We could round this to 147, but really a more realistic rounding to make sure that the patient gets all the doses, 150 milliliters. Now we need to figure out how much volume we are to administer with each dose. So we go back to our weight, 10.45 kilograms, multiply that times our dose recommendation of 5 mg per kg per day, and then we'll divide that by the 3 doses to get our per dose milligrams. That leaves us with 17.4 milligrams per dose. If you want a quick double way to check to see if our rounding of the volume is going to work out, let's say we have 7 milliliters per dose. We know that. We're going to give it 3 times a day over the course of 7 days. We solve for our volume that way. We get 147. Now it's time to write the prescription. It's important you can quickly calculate days supply. And here's a good example. You wrote a prescription 4 days ago for the following medication: hydrocodone, Tylenol 5/325, 1 tablet PO, Q8 hours PRN for pain. Dispense 15 tablets. And the patient's called your office today and says she's out of pills and wants you to write another prescription. So how do you calculate how many tablets should be remaining in her bottle? Well, we dispensed 15 tablets. She was supposed to take 3 tablets per day. So the day supply that we wrote on the prescription is a 5-day supply. Now, she's calling 4 days into her prescription. If she were taking 3 tablets per day, then 12 tablets would have been taken thus far. So if she should have 15 tablets, and she started there with 15, she should have taken 12. She should have 3 tablets still remaining in her bottle. Yet it is 4 days in, not 5 days in, and she's calling for a refill. So this kind of calculation is important because you will get early requests, especially for narcotics. Here's an over-the-counter example where you might need to advise a parent on how to administer a medication. Remember, the ibuprofen infant drops are a lot more concentrated than the children's liquid. We have a patient here who is 6.25 kilograms or 13.75 pounds. We take the weight, 6.25 kilograms, multiply it by the low end of the recommended dose, 4 milligrams per kilogram per dose. That gives us 25 milligrams per dose. To find out the volume of the medication to administer, we know the strength from the bottle is 50 milligrams per 1.25 mLs. That gives us 0.625 mLs per dose. And as you see on the syringe that comes with the product, 0.625 milliliters is a marking that a patient's caregiver could draw up in the syringe and administer safely. Here's a prescription we want to write for cephalexin, an antibiotic for a child who weighs 30 kilograms. We multiply out the recommended daily dose of 75 milligrams per kilogram per day, multiply that times 30 kilograms, and we get 2,250 milligrams per day. However, when we consult our drug reference, it also says that the maximum daily dose for kids for this drug is 1,000 milligrams per day. So we're going to max it out there and calculate our dose going forward with 1,000 milligrams per day. We have 2 different package sizes in this medication. So let's test both scenarios to see which one would be the most appropriate one to dispense and which volume to select in that strength. $1,000 milligrams per day is the same as divided 3 doses of 333.33 milligrams per dose. We'll need to round at some point, but we'll keep it like it is for now. 333.33 milligrams multiplied by the product strength of 125 per 5, that leaves us with 13.3 mLs per dose. We'll calculate the total volume we have to dispense at this strength. 13.3 milliliters per dose times 3 doses a day times 7 days of therapy. We have to dispense 279.3 milliliters to get the total volume for this course of therapy. And you'll notice in this package size of this strength, the largest package size is 200 milliliters. We could dispense 2 bottles of 200, making it 400 milliliters total, but that would be way more than the patient needs. Since the 125 per 5 strength was not really doing it for us, let's test 250 per 5. We need to get the same dose, 333.33 milligrams per dose. We'll multiply that by the new strength of 250 milligrams per 5 mLs. We're going to dose it at 3 doses per day for a total of 7 days. So how much total volume will we need to dispense in this one? That works out to 139 milliliters total volume to dispense with this prescription. Now you notice that higher strength has 2 volumes available, 100 milliliters and 200. So in this strength, 250 per 5, we can dispense the higher volume bottle, 200 milliliters. It will be a little bit over what the patient needs for the whole prescription, but not almost double like the last example. Now let's write our prescription. Cephalexin, 250 milligrams per 5 ml strength. Be sure to put the weight of the child on the prescription. The directions will be give 6.5 milliliters PO Q8 hours for 7 days. And the dose basis of that, remember we're maxing out at 1,000 milligrams per day, so the dose is 33.3 milligrams per kilogram per day in this case. And we're going to dispense the 200 milliliter package. In this example, we're going to give prednisolone for an acute asthma exacerbation. We'll do the weight-based calculation for a 34.1 kilogram kid using the higher weight-based dose, 2 milligrams per kilogram. Over the course of 5 days, the total dose will be 341 milligrams. Now, using the magic of colorful technology, I will now calculate the total volume we would need for each of the package strengths available in the pharmacy. Our next step will be to match the closest volume to what is available in the pharmacy. None of these required volumes really match up closely with the volumes available in these packages. The good news is the 15 milligram per 5 ml package comes in a stock bottle. That's a 4-pint bottle. So the pharmacy would just take the stock bottle and pour the exact amount needed into a smaller bottle to dispense to the patient. Now that we've decided to use the 15 per 5 stock bottle, we will need 113.7 milliliters to complete the whole course. It's probably more reasonable to just dispense a 4-ounce bottle. That's 120 milliliters.